All right, good afternoon, everybody. Thanks for being here, and I just want to say a few words thanking Dr. Alexander Scott, for her efforts, and I'll say a few words and then I'll hand over the microphone to her. But I just want to point out that Rhode Islanders should be very encouraged by the progress that our state has made on vaccinations over the last week. And again, thank Dr. Alexander Scott, General Callahan for the dedication through the pandemic and particularly over the last few weeks to get the distribution and the vaccines into the arms of the people of Rhode Island. So as a incoming team, merging with a current team, we've taken new steps, getting vaccines out of inventory and into the arms, building out capacity at the state's sites, and engaging municipal leaders in the vaccine rollout for Rhode Islanders over 75 and older in the municipalities. And as a result, thousands of shots went into arms in our state in the last week. We know much more needs to be done, but getting more shots into arms right now will get kids back to school, get people back to work, and get us back to normal. So there's more good news. We learned this week that the state of Rhode Island is receiving a grant of more than $64 million from FEMA to help cover associated costs for COVID-19 vaccine distribution efforts. This will help in our efforts to speed up the vaccine distribution for Rhode Islanders, helping on both state cost and also municipal cost. So one of the best ways that we can speed up the distribution is to create capacity. And that's what we've been working on for the last few weeks, and we'll continue over the next weeks to build that capacity so we can deliver more vaccine as the supplies come in. I was on a call this week with the White House, with governors throughout the country, and they are ratcheting up the supply, 1 million more doses this week, 2 million doses next week, and with Johnson & Johnson, that's what's being projected, if not next week, soon after that. So the supply is continuing, and I think that's really important. So that's why increasing the sites, both state sites and municipal regional sites, builds out the capacity in advance of the supply so that we can quickly get shots into the arms of people throughout the state of Rhode Island. So we need our cities and town leaders, and we've been working with them over the last 4 weeks and engaging them, and I visited sites now in Portsmouth, East Providence, Pawtucket, Central Falls, my hometown of Cumberland, Johnston. I've also visited the state sites in Cranston, at the Dunk Center. We are building out the capacity to meet the demand when the vaccines inventory continues and increases. So we want our cities and towns to operate the way they are right now, but the model that Dr. Alexander Scott will talk about is at 5 different state sites. As we get the municipal regional sites set up, they will move from their local sites into those municipal sites, those municipal regional sites, and again, continue to build the capacity. And things that we've worked on, one step that I've worked on is make sure that we can get more and more people eligible to give the shots, so to allow EMTs, advanced EMTs, to administer the COVID-19 vaccine. This, again, builds up our capacity to make sure that the people who are qualified are there for us to make sure that more and more shots get into arms. So I would just say one more thing on the municipalities and the importance there as they shift from their sites to the municipal regional sites that will be set up. We need to really continue to work on the fact that we need buy-in that people get their shots. Because the goal is to reach 70–75% of the state's population, and we're going to need municipal leaders and local civic organizations, and we're going to continue to work with them to make that happen. So I just talked to the people of Rhode Island, some of the things that I've been working on for certainty in terms of contacting. I have had a phone call with the Governor Ned Lamont in Connecticut, had discussions with Dean Graham Allison at the Kennedy School, who are now, providing information about how states are doing on the rollout of the vaccination. And that's all important information and backdrop to the work that we're doing. So earlier this week, I also participated in the call I said with the White House. In addition to that, I want Rhode Islanders to know that this transition continues in a way that is going to keep them safe. And transition is accelerating, as you can see in the media right now, that things seem to be working out in terms of the Senate, in terms of the confirmation hearings that soon to be set. So the theme, again, continues to be right now is that we want to make sure that people get vaccinated. We want them to stay safe. We also want to get teachers back into the classrooms. And so when I become governor, there will be a plan to get teachers and related personnel vaccinated, because we need to make sure that we get the schools open. And we're working on that right now with the advisory group that I put together, and we'll have some sort of a really strong plan and match that what's happened in Connecticut recently and states around the country that see that as a priority.